So what I've done is I've compared the two. I show you that once it opens up. Taken on the 11/20.
Okay.
So that was like 29/11. So 9 days apart. But of course, we did the surgery a few days after we took the scan. Remember, you were waiting for a few days. All right, now I just show you the side view. We can see already. So this was the original shape of your chin, and it had like a small cleft in between, and it's like a two small cornu, we call them, like horns. But on the outside, it looked nice and broad. And I didn't want to touch that, so you will see we have the same cornu.
I like that. So will it show a little indent when it's finished?
Maybe a little bit. Whatever was there earlier will remain.
Okay.
Okay, and then now this is the cut that has been done. So you can see the cut comes from somewhere half the way, much posterior nerve, and that's the advancement. I'll show you the other side also.
So will this little groove fill in straight, or would that create?
It should not, what can I say? It should not be visible, because if you look like this, what I've actually done is just contour this off, so it's almost like a straight line. It's not going to be visible.
Okay.
So I don't think you need to.
Oh, you shaved a little bit that part?
Yeah, so that it's not going to be visible. Now I'll show you the exact, I'll probably show you the millimeters, maybe another view. Such I can show you better. Yeah. So this is how the chin was, and you can see the step that's coming into place, and those are the plates and screws. And I'm going to show you. So you see this part of the bone was there, right? So that's essentially the movement that we have done.
Okay.
8 mm. That's exactly what we said, right?
Yeah.
So this is between the two ends of the lower jaw, which means we've actually brought it forward by 8 millimeters right here. As it goes to the sides, it's probably going to be 7 millimeters, a little bit less to the sides. I can show you that also. And the other thing that you can see here, I'll show you the length of these screws also if you want. We used 8 mm screws for you.
Screws.
Yeah, about 8 mm screws. The same advancement as we are achieving.
Yeah.
Okay, and then this is, as I'm moving the view, so you can see the two parts of the lower jaw or the chin. That's the plate that's coming into place. And now this is behind. So as you go behind, it's a small overlap.
And so one day the screws don't even need to be there.
No, they don't need to be there.
Yeah, but they'll probably stay, but you know.
No, but it's up to you. If you think that you don't want a foreign material there, you can take it off after 3 weeks or 3 months.
Oh, really?
Yeah.
Okay.
It's not a big deal. And in your case, we've just done 8 mm advancement, so it's that much easier to take the screws off. They will heal. The bone will heal in 4 weeks earliest. You can give it some more weeks and then you're done. I'll show you some other view also. So in this view also you can see the same thing that we've done. And that's the upper jaw.
You did something on the upper jaw too?
No, we didn't.
Oh, okay. This is what am I looking at now?
So now you're looking at this kind of cut. So again you can see the screws.
Oh, so from the bottom.
Yeah. And I'll show you as you come up. Okay, everything is fine. We also take these scans to check if all of these screws are in the right place, if it's holding well, if there's any asymmetry, if there's anything happening to the tooth roots. So everything is fine. I'm looking at everything when I'm just going through,
Okay.
obviously showing you the amount of advancement that we have done. also having a look at the other views, what's happening. And these are all basically different views of the same scan. So you can see how the cut was made.
Yeah.
And this is now the cut like this on the face. So we call it coronal cuts. And again, you can see the 4 plates, the 2 plates rather.
And I think this procedure was really smart for me because it brings everything together.
Yeah, it's a very nice procedure. And
it was like the teenager and the man.
Well,
I like it.
That's a nice way of putting it.
So when I asked if you can just see something, if there's any asymmetry here, because I'm talking to a few oculoplastic surgeons about my eyes. I'm trying to get them very symmetrical.
Okay. So meanwhile, I did see a bit on your eyes also, but on these scans, there isn't really any major asymmetry, so to say.
Okay.
So you were wanting me to comment on that?
Is one eye a little backward inside?
Not that obvious in the bony part. In the soft tissue things, maybe a couple of millimeters, a millimeter. I told you this on the first day itself.
Okay.
But I'm not someone who's like a real expert to take care of that.
Okay.
If it's a bluff, it's easy. That I do it, no problem. But if you are looking at trying to do a soft tissue change in terms of the size of the eye or the placement,
it's a complication. It's like when you can see the pupil, the eyes, it becomes very clear the direction of the eye where they're looking.
Sure.
So it's not really that bad, but it's one eye I just want to open a little so that you can see both pupils really nicely. It's a very refined thing. So I'm talking to different people. I just wanted to get an idea of the anatomy so that whoever I go to, then I'll have something to show them. Yeah,
sure. I mean, think about it. You just finished a lot of procedures now. You may want to give yourself some time.
Yeah.
I know you're on a mission, but back to back, quite a lot now, right?
Well, while I'm here, all the way in India, I have to cover everything that you can do.
Sure.
Because it's hard to come back.
I get that.
I got denied the first time, you know that?
The visa?
Yeah. And then it turned out they were wrong, and I still didn't get my money back. So
that's ridiculous.
Yeah. So getting to India is kind of hard. So I just want to make sure that we can cover everything, so that yeah.
But I think it's easier now, right? After 15th of November?
It should be. But, India is still quite far. It's like a 20-hour, 25-hour.
Yeah, it's a long flight. So how long did they finally give you a visa to get here?
It's not that the visa didn't take long. The airport was confused.
Okay.
And for some reason, they just didn't understand how it worked. It was really bizarre. And
that's strange too, because we do have a lot of people who do come in out of the US here. Yeah, with the COVID, things have changed because they create a lot of issues with the, with the vaccination. There was this other guy who came in even without vaccination. Would you believe that?
From
just a couple of weeks. Yeah, from the US. He came from Ohio, and he had an art. Cool. Look at that.
That's where I was born.
Oh, but you gave me a Manhattan address.
That's where I live, but
so
for the last 10 years. But I'm.
So we did a couple of job procedures for him, but he hadn't done vaccination either. So that's why he was actually trouble at the airport. But then eventually let him go because he had an RT-PCR that was negative. So I think a lot of reasons. One of which I think is a pandemic, which is currently a big problem, because earlier we never had problems for patients or anyone to travel out of US.
Yeah.
It was easy.
It works out perfectly, everything, because the delay allowed me to do the lips first.
Yeah.
And then the chin is better to do last.
Absolutely.
The hair, everything, it worked out so well.
Yeah.
And even when I came here, the delay a couple days was better because my lips got ready to heal.
Correct.
So things all happened.
That was not planned though, it was my health.
Yeah, but it still worked out.
Yeah, it still worked out.
And I've been on YouTube making comments like, oh, I'm here, it's great.
Thanks a lot for that. Really appreciate that. All right, so everything is looking good.
Okay.
All right. But as you know that you had some
bruising.
Yeah, which is not very common with our patients, especially after they undergo genioplasty. But having said that, it's more visible on anyone who's lighter skin. any of these bruisings, you know. So that's
And my skin bruises a lot.
exactly. And also not only that, the bruising is just that the blood has seeped in under the skin and it's just going to go away. It doesn't look nice, but in 2 weeks, max 3 weeks, it's all going to settle down. But what you actually have to take care of is not the bruising as much as the intraoral care and the dietary. Yeah.
Okay.
Intraoral care, I say, because you know we've done the incision from inside. It takes a while for it to heal.
How long?
Give it 7 days, I would think.
7 more days?
No, in all.
In all, so we're at 3 days.
We're almost there.
Yeah.
But give it a few extra days, like a couple of days.
Okay.
And the other thing is, you got to be careful when you brush even after that. So make sure you don't poke the
So
area
you're
and
saying
keep
after
it clean.
7 days, I can kind of do things normally because it's closed.
Almost closed.
Okay.
Yeah, the mucosa heals in 7 days. So I would think that that's the first important landmark you clear. So then after that you can start eating a little bit more normally.
Yeah.
But you would still want to give yourself another week and then pretty much go on to maybe 90% of your normal diet.
Okay.
Yeah, so that's the time frame you're looking
When
at.
will I be able to open the mouth wider? Because it's really hard.
It's still tight. That's because of all of these cuts in the bone and the muscles and the hematoma and everything. Some patients can take up to 4 weeks. Don't like force to open your
I
mouth.
notice when I like lean back, it feels like a stretch.
Yeah,
It
that's
doesn't feel bad. It feels kind of good. I just don't know if it's dangerous or not.
no, it's normal. You have a stretch here. That's because the muscles that we've cut and detached all pulling on this area. That's one of the reasons why when we do a genioplasty of this type, you also automatically tighten the areas here. The angle gets better. The breathing gets better.
That's
Sleeping gets better. If you see the amount of literature that's coming out, you'll be amazed. The benefits of a bony advancement genioplasty is a lot. There's a lot. And so it's not just the aesthetic improvement alone, like, you know, you saying it now, then you feel some tightness there, and that actually translates to, like I said, better sleep, better speech, better breathing, better airway, a lot of things.
Yeah.
In fact,
I got a burst of energy a couple days, like 2 days ago. I woke up like stretching and everything, and
cool.
I don't know where it's coming from. So much energy.
It could be part of this as well, and that's one of the benefits that these kind of jaw procedures do have, especially genioplasty.
In America, so I consulted with one person there. They had me do a sleep apnea test
Absolutely.
to see if they can make it worth it for the insurance, because it actually helps with that. But they told me I didn't have sleep apnea,
So that's because your chin was like just moderately retrusive, not severely. If your chin gets to be really back, then that directly affects your sleep, and then the OSA comes into part, obstructive sleep apnea. But even though you don't have obstructive sleep apnea, like as a diagnostics, in order to get insurance to cover your procedure, but do remember, because you've done a procedure on the bony chin, it does help your breathing.
Yeah.
So that is going to be a benefit anyways. So
That's
there
great.
you go.
So I think this is amazing. I think I have all the answers I need.
All right.
Thank you so much.
Pleasure, man.
So much fun.
Take care and be in touch.